Hi, it's Dr. Brian Lee from Aspire Plastic Surgery here in Fort Wayne, Indiana, and I would like to start the first part of our weight loss demystified. And the first is number one, nutrition. Why do we eat? A little interactive here. We eat food. But why do we eat that food? There are multiple reasons. One of them is certainly emotional. So you hear about emotional eating, comfort foods, but foods are also addictive. We'll talk about that later. But what I really want to address today is why we physically eat the foods that we eat. So there are two main reasons why we eat these foods. We need to get the nutrients into our body, into our cells, but we also need the calories to fuel every biological function, but also the physical function, moving our muscles and breathing. When we use these calories, it can go down one of two pathways. The first pathway is to create energy, and the second pathway is to create fat. The first pathway, again, pathway number one, we can create energy from these calories that we have freshly ingested, or this can go down to fat. The big question is, what determines whether it's pathway A or pathway B? The sole determinant as to engage pathway A are nutrients. If we don't have the nutrients that we need to absorb these calories and make them and turn them into energy, then the body will automatically take these calories we have freshly ingested and store them as fat. Fat is energy for future use. For example, we need multiple B vitamins to be able to turn the carbohydrates into glucose into our bloodstream that then uses insulin to go into our cells and takes that glucose into the mitochondria, which are the energy producing factories of our cells. And it goes through this long cycle called the citric acid cycle, or what we affectionately call the Krebs cycle, because Dr. Krebs was the one that described it way back when. I remember having to memorize this entire pathway, which don't ask me because I forgot it right after the test. But what I do know is you need multiple vitamins and nutrients to take those calories and convert it to the energy that the body needs. Once that energy levels are satiated, the body will then take the rest of the calories and store it in your fat for future use. That is the main trigger then, is why we need to get nutrients in and what happens if we don't have the added nutrients, if we eat empty calories. So foods that have a lot of sugars and carbohydrates without the nutrients, the body automatically takes it and stores it immediately as fat. Now, fat is also kind of a toxic buffer in our system. So when our body gets built up with too many toxins, it won't store it in your liver or your lungs or any other organ because it will toxify and damage that organ. So the body will put those toxins into the fat, which doesn't hurt the fat, and we'll talk about how we can convert the fat back to energy, but we need to get rid of the toxins. But that's in another lecture or two here. So again, we need these nutrients to form that energy. Now, when we talk about these nutrients, I'm talking about whole foods, plant-based foods, foods that are naturally on this planet. Once we start to process this food, we start to add more chemicals and additives, and the nutrient content decreases. With the scarcity of the nutrients, again, we kick back over to fat production, storage of those calories. What we also get concerned about is synthetic multivitamins. The body really doesn't recognize synthetic vitamins, and you need those vitamins in the correct proportions for the body to be able to absorb the nutrients and create the energy. The last tip I would like to tell you is that we want to get these nutrients in the morning as we start to consume calories. Because if these nutrients are in our system all throughout the day, subsequent calories that we ingest now have the nutrients that can be converted directly to energy and not to fat. Takeaways from nutrition. You need the nutrients and you need it in a natural form, And it's best to consume those in the morning, and that will help your body start to function the way it was designed. I just mentioned multivitamins. I don't take a multivitamin. This is what I take. It's Moringa Total Health. It comes from the tree, the Moringa oleifera tree, that has actually been studied and is noted to be the most nutrient-dense product or botanical ever discovered. As a matter of fact, our National Institute of Health, the NIH, studied this for an entire year in 2008. And their conclusion, and this is from them, not me, is saying that Moringa oleifera can cure, reverse, or mitigate over 330 disease processes. That's our government, the NIH, talking about this single plant product. Now, this is the brand that I like to use, the Moringa Total Health. I've tried multiple others in the past. This is what I find is most effective, and it's the most economical of any of the others on the market. My friend who formulated this actually is one of the experts, if not the expert, on moringa in the entire world. And when he formulated the MTH, he actually added a little bit of L-arginine. So L-arginine is an amino acid that actually is a nitric oxide precursor. Nitric oxide in our bodies is a smooth muscle relaxer that helps to deliver the nutrients to the cell much more effectively. So the Moringa Total Health is exactly what I like to use. We will share a link that if you want to get it for the same price that I do, it will be on our link.